Hello everyone, this video is in English. What I'm trying to do here is to make some videos where I'm gonna explain some basic ideas of medical informatics. So here I will start with a brief presentation of the theoretical background, and then we can focus more on some practical aspects in later videos. Okay, so in this video I'm gonna give a brief overview of these systems: HIS, PACS, and RIS. These are management systems used in healthcare, and the goal in this first video is to give you or to explain the differences between them. Okay, so first thing, let's start with the PACS system. PACS stands for Picture, Archiving, and Communication System. So picture, that means that here we are managing digital medical images. Picture. And that's why this system is a software that enables the management of digital images. PACS now is a necessity because most larger radiology departments have gone digital. That's why we find PACS in any radiology department, especially radiology department. Otherwise, PACS can be used in any department, not just in radiology, including cardiology, pathology, echocardiology, etc. Because we're going to talk about the other system which is dedicated just to radiology. I can say that its basic functions are three. The first one is storage. Why? Because it's an archiving system. It used a database to store images, so it's an archiving and communication system. The second thing is distribution, which means that this system can communicate with other system. It can actually send and receive images. That's why distribution is a basic and a key function that should be existing in any PACS. The second function is displaying or display images. Okay, any PACS should have a DICOM viewer in order to show DICOM images. We're going to talk about DICOM standard in more details later. Okay, so this is PACS. PACS can manage digital medical images. The second system is RIS or RIS. So that stands for Radiology Information System. It's used to handle the textual data related to imaging procedures. So here images, here textual data, and textual data like reports, like radiation dose data. Even if radiation dose data, we can find other systems that have this function. The radiation management system, radiation dose management system, or RDM. These are other systems that are dedicated to manage these type of data, the dose data. Okay, so this is another thing. Here, the RIS is, as I said, is unique to radiology. Other departments have similar systems that are tailored to their textual workflows, and these systems are known as CIS, Clinical Information System. We can find in radiology, we can find as a CIS the RIS, and in pathology, for example, we can find the LIMS, LIMS, Laboratory Information Management System. Okay, let's talk about the HIS now. HIS, or we can find the the PAS, PAS. So that stands for Hospital Information System or Patient Administration System. So this is a database application just like the others, and its primary function is to store the demographic and control details of patients. So the HIS is designed to manage medical, financial, and other business related functions. Not just medical, but it can manage financial information and business information too. So one of the examples that I can mention here is the billing function. This is a function that could be integrated within the HIS systems, which speed up the process of billing patients and insurance providers. And this is a very good tool to provide safeguards against fraud and efficiencies. So this is the idea behind the HIS. It's a system that control also the workflow of all the hospital. So an HIS is linked with all the other systems to ensure that records of other systems are actually match the primary details. For example, if we have a patient ID created by our HIS system, this patient ID should be the same in all the other systems used in the hospital. That's why these HIS systems should be related or linked with all the others. Okay, so here I'm gonna give you an example. Let's give you an example to show how these systems work. Let's say this is a patient, okay, and this is a hospital. In the hospital we have these systems, the HIS and the other PACS, for example, the Ris and the other one. Let's say this is his first time going to a hospital. So the patient here comes to the hospital, and one of the first things that he may do is to getting registered. So the patient will get registered in the hospital, and here the medical staff will enter the patient's information within the HIS system. I'm talking about information like his name, like his birth date, like his social security, his address, I don't know, any other regular information that could be registered here. Okay, and now the patient is registered. The HIS will transmit and communicate that patient registration message to other systems, to PACS and to the RIS, so that these other systems could be aware of our patient. And now if our patient needs an exam, the HIS will send an exam order to the other systems so that they could be aware of this. The patient could then take his MRI, his CT scan, or any other exam, and the images will be stored within the PACS system. You can find here the DICOM images, and the radiologist can read these images and make his reports on the Ris. So the reports would be made by radiologists about this patient on the Ris system, and then this report would be sent to the HIS so that the HIS can be aware of the existence of these reports. Okay, so of course these reports will be sent in a text format, and text format here are managed using the HL7. HL7 stands for Health Level 7, and it's like a standard of communication used by clinical information systems for transferring health information. So it's like a language, it's like a tool or a way of communication. Okay, I think this is an example where I try to briefly show you a workflow that could be used in by these systems. Hopefully that this has been helpful to somebody who want to understand and kind of know what the basics are of a clinical management system. um, and after this video, I'm gonna focus on I'm gonna talk first about DICOM standards, and then we can focus on some practical aspects. So until next time, take care and assalamu alaikum.